All right, any questions? Yes, hey. Yeah, I'll let Dr. Toomey speak more to that. She's probably got more later data, as we say sometimes, on that. I will say that that's what's so interesting about the scenario that we're in right now. I want Georgians to know that we are going to be, I told people when we started the vaccine rollout that it was going to be a methodical process, and that we knew we would hit situations that, you just don't know how this is going to go. And that's the problem we have right now. We have more people that want to get vaccinated in the metro areas than we have vaccine, and it's completely the reverse of that in parts of rural Georgia. The demand is not there from the people that want to get it, but the vaccine's there. So that's why we're changing, we're moving. We talked to Dr. Redfield about this yesterday. The CDC guidance is exactly that. It's guidance, but every state's different. They got different scenarios, and we're dealing with the Georgia scenario. And like Dr. Redfield said, and Dr. Toomey and I both agree, if there's a vaccine sitting in a freezer somewhere, that is not what we want. We want somebody to be getting it, and that's why we're expanding the criteria. From all indications that I know, we're going to continue to receive shipments of the vaccine, and we're going to do everything in our power to get it administered as quickly as we can to the people that need it in an orderly fashion. And I'll let Dr. Toomey speak to the amounts.
This always happens. I get stuck up, but hey, this is I wear my mask. In Metro Atlanta, we are actively vaccinating now. And so it isn't a lack of vaccines, it's just really having the capacity to vaccinate the number of people who want it, which is a good thing, that there are healthcare workers here who want to be vaccinated. And that's why, yesterday when we met with the Metro health directors, we thought that the best way to address this is to have a mass vaccine clinics, several of them probably throughout the metro area, not just in Atlanta, but in a number of areas. And they're working together right now on that. And I suspect we may see it as early as next week, as we must ensure we have enough vaccine, but we are likely can do like 5,000 in a single clinic, and that's what we're aiming for. But right now, we are vaccinating. I know that many of the public health districts in Metro are having vaccination clinics this weekend after New Year's. And so that will continue. So it isn't that we're not vaccinating, we are. But the priority will be to get the healthcare workers, but we'll quickly move into that other phase of vaccinating, particularly the 65 and older, which is of great concern to all of us in public health. I mean, allocation is the vaccine that's come in, distribution is where it's gone, but that doesn't mean equilibrate into vaccine in arms. And it's a little more complicated to get it from the box into people's arms because of the logistics of how we do that and how you set up. And that's why it's so important for us to have appointments. I saw a news report of other states where they had people, waiting overnight for vaccines. No, that's just unacceptable. We have to make sure we have the vaccine available, but that it's easy for people to come in and get that service, just as it was for individuals to get the COVID tests at our test sites. So we're trying to aim for that same customer service and ease, as well as educate everyone about the safety and efficacy of this vaccine. And if there's anything that you all can do to help us, please help us get that message out. I have looked at the data, I have looked at how the vaccines were developed. Nobody cut corners. They were able to do it in a record amount of time that surprised many of us in the public health field, but it wasn't because any safety measures were were cut. You know, the paperwork and the bureaucracy, you know, was streamlined to be able to make it fast because it's needed fast. And I hope that as other people get vaccinated, as people's mothers get vaccinated, that they will be willing to get vaccinated as well. Well, there's a couple of issues. One is the vaccines delivered is always a day or two behind because we only know what people have entered into the vaccine reporting system. And so we know we've delivered more vaccine into people's arms than we actually have reported because we're dependent on people, providers, whether it's public health providers, private sector providers, hospitals, reporting that. And that's true statewide. And Dr. Redfield even talked about that with me yesterday, is that, you know, there always is going to be a delay in reporting. And so it looks like we haven't done our job. But in fact, we have. It just takes a while to have the numbers catch up with where we are. And the other thing is, I think as we get more providers on board with vaccine, we'll be able to actually increase that considerably. So I'm not worried about that. This is something that you're seeing in virtually every state, and that part of that lag is just reporting, and part of the lag is just being able to set up the clinics and ensure there's the appointments that people can get in and not be waiting, as happened yesterday in sister states. Well, you know, we talked about that. We actually talked about that, and one of the decision points was we need the vaccine and want to begin to expand vaccinations to older individuals who are at high risk. You know, older individuals, along with the long-term care facility residents, are at the highest risk of death and complications. You have it here. Why not just begin and be very aggressive here in Metro to reach those other populations rather than take away from somebody else. And we can do that. We have sufficient vaccine on board now and expect more in. We were told yesterday in CDC in 2 shipments. So I think that we'll be sad, and particularly with these mass clinics that we're planning to do in partnership with some of our university partners, we'll be able to process those quickly and then also move into the additional risk groups as well. So and transporting vaccine also isn't that easy. Remember, there's a cold chain you have to follow. The worst thing that could happen is you say we're going to transport it and then you waste vaccine because you break the cold chain. That would be a true tragedy.
Well, I think the team just told me too, we actually got 120,000 doses of vaccine this week. We don't know what we'll get next week, but you have to assume the supply chain's going to keep coming. So really by the time we tried to do all the logistical things to move the vaccine around, we'll have new vaccine. So it really it's not worth it. We're better off just getting that vaccine to people on the ground today, you know, in the next couple of days versus trying to move it and it'd be 5 or 6 more days and then we have other vaccine coming in. And that's part of what our team is working on now. I mentioned the infusion centers, but we're also continuing to change and look at the logistics so we're getting the vaccine where the need is. I mean, this is one of the things that's, this whole plan that we have, we're going to change it weekly if we need to get the vaccine where the demand is and where we need it to protect the most vulnerable, to try to give some relief to our hospitals, and that is our commitment to continue to do that. All right. You want to speak to that, Dr. Toomey?
This is really an unusual situation in that the CDC works with either McKesson for Moderna or Pfizer ships directly to our vaccine sites, whether it's a hospital, a private provider, or to our public health clinics. We do have some being shipped just to have a backup in case there's a shortage at our storage site that holds a stockpile. So those logistics are handled through Operation Warp Speed. When you transfer from one provider to another, then we would engage the state patrol or our local ability to move. And that may happen more and more as we move further down the road, as providers only need a few doses rather than 100 or 975 doses as are in a box of Pfizer. So, we much of the logistics and the movement comes directly through the CDC process, but then the local transport, when that would happen, would be through either our immunization program or likely state patrol.
I'll just add a couple of points there. One, I think a good example of this, we were at a nursing home facility Monday doing the vaccine at that facility to their healthcare workers. There was another facility similar to that one in Gainesville that didn't get the allotment Monday, but I found out they got it Tuesday and were overjoyed. So they didn't have the vaccine Monday, but it got to them Tuesday, and they immediately started inoculating their staff and residents. I would just tell people that in the days to come, as this plan continues to broaden out to the general public, we will use every resource that I have available to me, whether it's law enforcement, other agencies that we've had at our disposal, just like when we shipped, if we needed to fly a ventilator to a hospital, we did it. If we needed to fly surgical gowns, masks, PPE to medical facilities early in the pandemic, we did it. We've had State Patrol drive, we've had DNR drive, we used the National Guard in a lot of places, testing sites, infectious disease control, cleaning. They're still working at our food banks. We will use every available resource to get the vaccine out as quickly as possible to help be part of the existing logistics network that we already have with what Operation Warp Speed is set up and where the vaccine's going, and we'll continue to do that as this broadens out to the general public. Well, we are continuing and have been for probably almost 2 weeks now at looking at additional bed supply to be prepared for whatever's coming our way. It's so hard to predict when this peak will end and we'll start going the other direction. We can't just hope for that. We've got to plan for the worst and hope for the best. So we are currently digging into a lot of different options there. I will say that there's a lot of different places that we could do that, including outside of the metro Atlanta area to help some of our more rural hospitals. The big issue that we have and every state has is staffing, and that is in a short supply right now. So we're continuing to try to work through how we deal with that, which is one reason that we're going to be pressing forward with these infusion centers, because we can cut down on the number of these vulnerable patients that may end up in the hospital by getting them these antibody drugs before they get real sick. That will help us a lot. And getting people vaccinated and getting our citizens to follow the guidance and the guidelines to help. We're at a critical point, and we've been at critical points in the past, but we've got to all hunker down, do the right thing, and stop the spread and flatten the curve. All right, thank you, everyone.